Hello, my name is Rafael Vidal. We are in ESC TV live from London, and it's a pleasure for me to present Claude Park. It's the Young Award for Clinical Science, and I'm happy to have you here. And my first question will be, which you decide to study?
Well, in our ageing population, both cardiac and cognitive dysfunction are on the rise. So we wanted to look at whether LV dysfunction in the subclinical level is associated with cognitive decline.
And so which methodology did you plan to do the study?
So it's a 20-year triethnic follow-up study. We have data on 1,200 individuals. We have echocardiogram, cerebral MRI and cognitive function testing. And we wanted to look at the associations between both brain volumes and brain function with left ventricular dysfunction.
Okay, and it was, I was thinking now, it was a well correlation between the cardiac imaging techniques in these patients to check the cardiac dysfunction?
So we only had cerebral MRI and our echo, and what we found was there's a significant association with diastolic, systolic and global LV dysfunction and a decline in brain volumes and a decline in cognitive function testing.
How did you check the cognitive function? This common test, a special one?
Yes, so it was a specialised test that looked at different cognitive domains. So overall cognition, memory, attention and executive functioning, which are the skills you need in everyday life for problem solving and multitasking.
And if you have to choose one of these parameters in the cardiac imaging, what do you think is the most predictive for declining cognitive function?
I think that executive function is the cognitive domain that seems to have the strongest relationship with a decline in left ventricular function.
Okay, I was wondering for the clinical daily practice, what do you think are the take-home messages if you have to summarize some part of the study?
Well, dementia is a public health priority, so if we can identify targets for early modification, such as left ventricular dysfunction in the subclinical stage, then we can try to prevent or even delay dementia in our ageing population.
Which population do you think it's more interesting to screen to find this dysfunction?
Well, I think our population is an older population, and that's when cognitive function is beginning to decline. However, our data suggests that changes in your vascular system, such as left ventricular dysfunction, have an effect on your cognitive function from midlife.
So I was wondering too, if there are how to say any other findings that you want to highlight that are not well studied sometimes. Do you think there is something of interest?
Sure. So what we did that other studies haven't done is we investigated other confounding pathways to make sure that there really is a direct relationship between left ventricular function and brain aging. So we investigated the role of several vascular risk factors such as arterial stiffness, inflammation, microvascular disease, and these couldn't explain the associations that we found. It seems as though a decline in left ventricular dysfunction has a direct effect on brain aging. However, the mechanisms are not exactly known yet.
Thank you, because I think it's a really interesting topic. We have a lot of aging population. Thanks for coming to the ESC TV studio, and we are happy to have you here. Thank you.
Thank you very much.